Parents Bridget and Adam Thau know all about going to the emergency room. Bridget is a nurse and the mother of 3 boys, 2 of whom have visited their local ER a total of 7 times to date and counting.
Well, my middle child, Kevin, we have been to the emergency room 6 times in total, 4 sets of stitches and 1 ear infection and 1 broken collarbone. And Liam, he was there once with a broken finger.
The first one, I was really, really little. I fell out of my bed and cut my chin. And the second time, I got hit with a hockey stick in the head. The third time, I got hit in the head with a fence. And the fourth time, I hit my head on the table.
Kevin actually has his name over the room in the emergency room because he's been there more than any other patient.
No.
The boy's father is actually an emergency room physician, so he's got some good advice for parents.
To me, the most important thing in preparation is to know the hospitals in your community. Those hospitals that have pediatric emergency departments seem to do a much better job with kids in an emergency than hospitals which are not used to having the pediatric population.
Of course, since injuries, not illnesses, are the most common cause of death and disability in children, even the busiest pediatric emergency department would be considerably quieter if recommended safety precautions were followed. From securing medicine cabinets with plastic safety latches to ensuring children always wear helmets when bicycling. Simple precautions save lives, but still, kids are kids, and kids get hurt. So parents, you need to learn the basics of emergency care. That is, know in advance what constitutes an emergency and when to call 911, what hospital to go to, what type of basic first aid to learn, and if you do end up going to the emergency department, how to behave for your child's benefit.
I remember bringing my own child to this emergency department when she was about 6. She had a laceration on her face. She grew up here. She's been here really thousands of times. It's just my buddy. And she was completely fine with being here. We went into the room and I was in tears because it was my angel on that table with blood on her face. And when my daughter saw me tearful, she started to cry. Children so accurately reflect the emotions of their parents, so it's really valuable for the parents to be under control as much as possible.
So what illness or injury merits a trip to the ER? There's a long list of less obvious conditions that would justify a trip to the ER. For instance, a high fever, prolonged vomiting and diarrhea, especially if they lead to dehydration, unconsciousness, breathing difficulties, an irregular heartbeat, whether too fast or too slow, severe headaches, especially if accompanied by a high fever, the loss of an adult tooth, any and all animal bites, head, neck, and back injuries, ingestion of poisons, chemicals, or inappropriate medications, and unexplained or unusual behavior. Once it's been determined that a trip to the emergency department is necessary, the next decision is whether or not to call 911 in order to help you get there.
I would always feel that you say to yourself, what would happen with this in my car? If they got worse, would I be able to do something in the car on the way over? And if the answer is no, then you call an ambulance.
Sometimes moving a severely injured child can make the situation worse, and you'd really rather wait for a medical professional, provided that they are no longer in jeopardy. You wouldn't want to leave them in the street necessarily. We know that if those children who have been submerged or suffered a near drowning event are stabilized rapidly, close to the body of water, they ultimately do far better than if we wait for them to come into the medical center for evaluation.
If there's ever any doubt in your mind about the severity of your child's condition, remember that it's better to be safe than sorry.
If someone is concerned and feels that the best resource available at that moment in time to care for that child is the emergency department, then that's where you need to go.
10-year-old Kevin Thau, a 6-time emergency room veteran, has some advice for his peers and anyone else who might find themselves heading to the ER one day.
Don't be scared, because the nurses are very nice to you. They treat you well. They, you know, so you don't have to be scared no matter what happens. Broken bone, split open head. You know, it's not bad at all.